what is called peripheral heart. What is called peripheral heart? Lower extremity. At the lower extremity, which muscle is called peripheral heart? Soleus. Because there is profuse venous network. Likewise, lateral pterygoid muscle. Lateral pterygoid muscle also called venous pump, because around and within lateral pterygoid muscle there is a reach of network of venous plexus within the lateral pterygoid muscle. So if lateral pterygoid muscle comes as a short note, apart from its action on the mandible, you should not forget to mention that it also acts as peripheral heart, because in, around and within this lateral pterygoid muscle there is a rich venous network. Right. Now we have to see from where blood is coming to this venous network. Right. All the veins accompanying the maxillary artery drain into the pterygoid venous plexus. So how many branches are there in maxillary artery? Maxillary কতটা ব্রাঞ্চ আছে রে? maxillary artery একটা ছোট্ট আর্টারি কতটা ব্রাঞ্চ আছে জানিস? ওটা very good, 15 branches. You have to memorize that. 15 branches of the maxillary artery. Maxillary artery, like subclavian artery, it is also divided by one muscle, that is lateral pterygoid muscle. Up to lateral pterygoid muscle, its origin from lower part of the pterygoid muscle is the first part, deep to lateral pterygoid muscle is the second part, and beyond the lateral pterygoid muscle is the third part. From each part, 5 branches it gives off. Out of these, the branches from the first part, they will pass through foramina of the base of the skull. Likewise, from the last part, the third part, all branches will pass through the foramina. But the branches from the second part, it will not pass through any foramina. So you have to know through which foramen, which artery is passing. If this base of the skull is given to you, you will be asked. There are so many foramina. Through each foramina, which artery or nerve is passing through. Right. Before that, I should discuss another important applied importance. That is, it is related to pterygoid venous plexus. That is the danger area of face. What part of the face is called danger area? Not this one. Only upper lip up to the, in some books it is up to that, in some books up to the root of the nose. From the root of the nose, including the upper lip, it is the area of the angular vein and facial vein. That area is known as danger area of the face. Why? এখানে কোনো ব্রণ ট্রণ হলে এগুলো ফাটতে যাচ্ছে, বিপদ আছে। If there is any acne or any pimples, you should not squeeze it with your unwashed hand, because from there the infection may go into the cavernous sinus. Now you have to know the path of the cavernous sinus. If this question comes, why this area is called danger area of the face? Because from this area, septic foci, septic emboli may pass through the cavernous sinus. Cavernous sinus is present within the cranial cavity on either side of the body of the sphenoid bone. This cavernous sinus, how it is formed? Cavernous sinus is formed. Any sinus within the cranial cavity will be formed by the two layer of the dura mater. Within the brain there are two layer of dura mater. One is called, which is applied to the bone, that is called endosteal layer, and inner to that endosteal layer there is another layer that is called meningeal layer. When these two layers will separate, there will be a space created, and that space contains blood, that is called venous sinus. So this cavernous sinus is one of the venous sinuses, right? Now, how from the face the septic emboli will reach the cavernous sinus? You have to know the path. How facial vein is formed? How facial vein is formed? Bolo. How facial vein is formed? Interjugular vein facial vein তৈরি করে। facial vein branch होता है, vein branch है tributaries. How it is formed? প্রথমে পেরিফেরিতে ফর্ম হবে, তো তারপরে যাকে তো পেরিফেরি যাবে। এ তো এখন থেকে হাই তুলতে শুরু করেছে, মানে দ্যাট মিনস কোনো অ্যাটেনশন নেই। হ্যাঁ, হাই তোলা মানে অ্যাটেনশন নেই। তো হাই তুললে তাতে কী হলো? ওই টেরিগয়েড ভেনাস প্লেক্সাস পড়েছি, এতে কী হলো ভাই বল? এই হাইয়ের সঙ্গে টেরিগয়েড ভেনাস প্লেক্সাসের একটা সম্পর্ক আছে। এই যে আজকে টেরিগয়েড ভেনাস প্লেক্সাস পড়ছি, হোয়াট ইজ, if you yawn, then what will happen? This is pterygoid venous plexus. Pterygoid venous plexus will be squeezed and the blood will pump out of the venous sinus and go to the heart. Buঝলি? Facial vein. First of all, there is supraorbital vein and supratrochlear vein, and there is accompanying artery also in the same name. This supraorbital and supratrochlear vein will unite at the medial angle of the eye, that is called medial canthus of the eye, and it will form angular vein. This angular vein will be continued as facial vein. Facial vein. Now this facial vein is connected to cavernous sinus by, there are two veins in connection with the orbit, superior ophthalmic vein and inferior ophthalmic vein. These two vein connects the angular vein with the cavernous sinus. Facial vein also. Facial vein, one of the tributaries of the facial is the deep facial vein. That deep facial vein will go to the cavernous sinus, pterygoid venous plexus, and from the pterygoid venous plexus through an emissary vein, it will be connected with the cavernous sinus. So these are the three routes through which the septic emboli may reach the cavernous sinus. So how the patient will present to you if there is cavernous sinus thrombosis? How they will come to you? Patient's symptom কি হবে? What will be the symptom of the patient? There will be exophthalmos of the eye. Eye will come out, it will protrude out, and there will be pain. When the patient will try to move the eye, there will be pain. Ophthalmoplegia. So exophthalmos and ophthalmoplegia. If you take history, he will give he squeezed the pimples or any boil or furuncle etc. at the danger of the face. From there, this focus, that is septic emboli, has reached the cavernous sinus. Right? Now let us draw the diagram. First I will discuss about the maxillary artery and their branches. Right? Maxillary artery and their branches. Now maxillary artery is the branch of which artery? External carotid artery. It is the terminal branch. Sit down. This maxillary artery pass through the inner aspect of the neck of the mandible. Suppose this is the superficial temporal artery, and this is the one of the branches of the maxillary artery. It passes deep to the medial aspect of the neck of the mandible, right? Now here, before it entering into the lower margin of the lateral pterygoid, it will give off 5 branches. Number 1 branch, it will go to the external ear. Another one will go to the middle ear. They will pass through. I have already told you the branches from the first part of the maxillary artery, all branches will pass through foramina. Now this artery, deep auricular artery will pass through petrotympanic fissure. Not petrotympanic fissure, squamotympanic fissure. It will pass through squamotympanic fissure and will enter the outer aspect of the tympanic membrane. Now this anterior tympanic artery, the first branch, this one is the deep auricular. Then this one is the anterior tympanic. Anterior tympanic will enter into the middle ear, and it will pass through the petrotympanic fissure. Another important nerve pass through the petrotympanic fissure. What is the name of that nerve? Quadratympanic nerve pass through the petrotympanic fissure. So along with this, another artery is passing through. What? That is anterior tympanic artery, right? Then another artery, that is middle meningeal artery and accessory middle meningeal artery. Right? Now this middle meningeal artery will pass through which foramen? Foramen spinosum. And accessory middle meningeal artery will pass through foramen ovale, right? So these are the arteries of the first part. Now come to the second part. Second part actually lies deep to the lateral pterygoid. You know lateral pterygoid muscle is inserted into the anterior aspect of the neck of the mandible. So this is the pterygoid. Now from here it will give off branches to the muscle of mastication. Muscle of mastication. Number one branch is this branch will go, that is masseteric. Then it will give off one branch deep temporal, by two heads, deep temporal. And another branch will go to the medial pterygoid and lateral pterygoid, right? Medial pterygoid, lateral pterygoid. So these are the branches of the second part. Second part কি হলো? Masseter, temporal, medial pterygoid, lateral pterygoid and আর কি হবে? Buccinator. আর একটা ব্রাঞ্চ আছে buccinator. Now this artery will enter into pterygopalatine fossa. So pterygopalatine fossa, you know, to enter into the pterygopalatine fossa, through which fissure it will enter? Pterygomaxillary fissure. This is called, it will not be visible from distance. Here there is a fissure, that is called pterygomaxillary fissure. Through this pterygomaxillary fissure, it will enter into a space. That space is known as pterygopalatine fossa, and the door through which you are entering, that door is known as pterygomaxillary fissure, right? Now it will enter into the pterygopalatine fossa. Within pterygopalatine fossa, it will give off branches. How many branches will give off? Number one, number one branch is greater palatine. Second branch is, this greater palatine will enter into the, actually just to try to remember the name, because as your skull has not yet been started, so it will be difficult for you to know the actual course, but you should be acquainted with the terms, right? Greater palatine. Number two, pharyngeal branches. Pharyngeal branch. 3. Actually, first branch should be posterior superior alveolar. posterior superior alveolar. It is coming from the posterior aspect. Superiorly alveolar means upper tooth. Superior alveolar means upper tooth. Superior alveolar, you also posterior superior dental artery, you may call it. Dental artery, right? Now, greater palatine. Number 2, pharyngeal branch. Before pharyngeal branch, another branch will come, that is inferior orbital. Inferior orbital. Inferior orbital. Then another branch that will go and supply the pharynx to pharyngeal. An artery to pterygoid canal. An artery to pterygoid canal. Pterygoid canal. And now this artery, as this phenopalatal artery, it will pass to the sphenoidal foramen and will supply the nose. Right? The first part gives off 5 branches. Number 1, deep auricular. Number 2, anterior tympanic. Number 3, middle meningeal. Number 4, accessory middle meningeal. And third will be actually, I have কি বলেছেন আমরা থার্ডটা? Buccal, not buccal, it should be the artery which will enter into the mandibular foramen. What will be the name? The nerve which entered into the mandibular foramen is the name of the nerve. Inferior alveolar. Inferior alveolar. The artery should be inferior alveolar. Inferior alveolar. So these are the 5 branches. Right? Now the muscle of mastication from the middle part or second part, it will give up the maxillary branch. Number 2, artery to the pterygoid, medial pterygoid, artery to lateral pterygoid, and artery to masseter. 4, 5টা কি হবে? 5 should be buccal. 5 should be buccal from the second part. ঠিক আছে? ওটা একবার দেখে নিবি, ওটা ভুলে গেলে একবার বই দেখে আমাকে বলবি। From the second part, it will give up the 5, from all part 5 branches will come out. So there are 4 muscles of mastication. So another artery, I think, should be buccal, because maxillary is the accessory muscle of mastication. So it should be buccal, but you will verify it, right? Now from the third part, which is entering the pterygopalatine fossa, it also gives up 5 branches, and it will not be visible from here, and also we will not dissect that part. Only you should memorize for your examination purpose, right? There will be 5 branches which will enter into the pterygopalatine fossa. That is posterior superior alveolar, which is supplying the upper tooth. Next is a greater palatine. It will supply palatine, so palate. Number 3, inferior orbital. It will supply the orbit, lower part of the orbit. Pharyngeal, it will supply the pharynx, nasopharynx, and artery to pterygoid canal. So these are the 5 branches, and the artery itself will be continuous, sphenoparietal artery, and it will pass through the sphenoparietal foramen and supply the nose. So these are the branches of the maxillary artery. So each maxillary artery is accompanied by vein, and almost all these veins will be draining into the pterygoid venous plexus. Where pterygoid venous plexus lies? Where pterygoid venous plexus lies? Around and within. Around and within which muscle? Lateral pterygoid muscle. Lateral pterygoid muscle. This venous plexus is known as peripheral heart. You have already heard the name anatomical peripheral heart, that is gastrocnemius and soleus. Here it is also called peripheral heart, which lies within the pterygoid venous plexus. आगे दिन पढ़िए lateral pterygoid. What is the function of the lateral pterygoid?
Lateral pterygoid protrusion and depression of mandible.
Very good, fine. Apart from its action on the mandible, another function this is, that is, it acts as the peripheral heart, because there is a rich venous plexus within this lateral pterygoid muscle. From where this muscle takes origin, you know?
Lateral pterygoid, medial aspect of lateral pterygoid plate.
Not medial aspect, medial. Lateral aspect, lateral. Medial aspect, medial pterygoid, lateral aspect, lateral pterygoid. So this lateral pterygoid plate is sandwiched between the two muscles, pterygoid muscles, right? Well, maxillary curve branch. Maxillary curve branch. Maxillary artery, branch of which artery? No, maxillary itself, this branch of which artery? External cavity terminal branch. External cavity terminally branches into two. That branching occurs where? Where? Terminal branching টা কোথায় হয়? ওই যে anterior triangle কি করছিস? দেখেছিস? Have you seen the maxillary artery and superficial temporal artery? Have you seen? দেখেছিস? Maxillary artery and দেখেছিস? কোথায় দেখেছিস? Anterior triangle, have you seen? Anterior triangle में these two arteries, branching of these two arteries, have you seen? Superficial temporal and maxillary, have you seen? It is the terminal division of the external cavity artery. Have you seen in anterior dissection? You have not seen. Why you have not seen? Because that division occurs within the parotid gland, and we have not dissected parotid gland to show you the terminal division. So you have not seen. This artery, maxillary artery, passing on the medial aspect of the neck of the mandible. Along with it, there are two important structures accompany it. What are they? One is auriculotemporal nerve, which lies above, and maxillary vein, which lies below. So this pterygoid venous plexus will form, they will drain into the, from pterygoid plexus, the maxillary vein will come out, and this maxillary vein, where it will drain? Maxillary vein, where it will drain? Maxillary vein and superficial temporal vein, it will unite to form retromandibular vein. Retromandibular vein. Right. Now come to the danger area of face. So this is the about pterygoid plexus. This is enough. So how will you describe pterygoid venous plexus? It is the plexus of the vein which lies within the muscle or around the muscle of lateral pterygoid, and it will drain into the maxillary vein, and within it, pterygoid venous plexus, what other veins is coming from outside? Number one, facial vein. Facial vein is connected with this pterygoid venous plexus by deep facial vein. That deep facial vein lies at the anterior margin of the masseter. It pierces the sartorial pad of fat and enters into the pterygoid venous plexus, right? And from there is a communication between pterygoid venous plexus and cavernous sinus by a small emissary vein, and through that emissary vein it will reach the cavernous sinus. So indirectly it is communicating. A direct communication is from the angular vein. Supraorbital or supratrochlear vein forms at the inner canthus. That is the angular vein, and that angular vein is connected by superior ophthalmic vein into the cavernous sinus directly. So the draining area of this vein is dangerous area of the face.